Good morning, everyone. Now we are going to start second session. So first of all, I am going to call the chairpersons. So first chairperson is Dr. Govind Kumar. He is a MD Medicine physician. Please, sir, kindly come and join. And the second one is Dr. Mohan Lal Gupta. He is MD Microbiologist. I am requesting to you, sir, kindly join. So now it's time to call first speaker. Our first speaker is Dr. DrDeepakJumani, sir.
A very good morning. It's truly an incredible opportunity to be here amidst you gracious ladies and gentlemen to talk about a topic which is still a taboo. But how long do we continue this subject to be a taboo? HIV was a taboo, it's now over because people have started talking about it. The first take home which I would give you all is that every physician in their history taking must ask their patients that do you have problems in making love? It's not a vulgar thing, it's not bad, it's most needed, and you'll be surprised to know that your patients are waiting for you to initiate a dialogue on this aspect. And especially patients who are 30 plus, as early as possible, having family history of metabolic syndrome, they all have some issues in the bedroom and they need to be addressed because they've got a lot of critical events which they have to face if they are not treated or counseled very well. With pranams to God and thanks to my teachers Dr. O.P. Kapoor, Prakash Kothari and Sashank Joshi, I beseech them to bless me always.
This happened. An old couple were watching an evangelical program on the television. The preacher was going full on and was promising he's going to heal them and all that stuff. So over the television he's going to heal them. He said, place your hands wherever you have problem in your body, I will heal right now. So the lady put her hand on her throat and sat because she had a thyroid issue. The man looked at her and then put his hands upon his groin and sat. She looked at him and said, John, he only said he will heal the sick, he did not say he will raise the dead.
The four deadly urban civilization diseases are diabetes, obesity, dyslipidemia and hypertension. And every patient having this have some issues in the bedroom. Every 6 seconds, one patient dies of diabetes and two develop diabetes, and it's a sexual health tsunami of our century. There is threefold increase in patients having erectile dysfunction in diabetics compared to non-diabetic. In India, the sexual health today is emerging as a new parameter of having a strong relationships. Gone are those days when women were thinking about financial securities, etc. as the main thing in relationship once they got married to boys. But today, they're not bothered about financial security, they are earning equal and more to men, so they want something more, and what else they would need. Let me give you a new perspective. Friends, diabetes is a fast growing, lifelong challenging for rich and poor globally. Most important to learn, it's preventable, treatable and reversible. Over 1 billion Indians are affected in diabetes and pre-diabetes today. A largest study in KEM, ours, 56,000 patients, men had erectile dysfunction, early ejaculation, low desire, and women had low desire, and depression was seen as the most common thing. And this is rising trend in India, and particularly in the younger age. And these patients have a higher risk of death, studied by EMAS studies, etc. Pre-diabetics are more prone to these effects, and severity of erectile dysfunction increases in them progressively. Both type 1 and type 2 diabetics suffer from it, and the most challenging thing is that ED precedes coronary artery disease by about 2 to 3 years. So once they have ED, this will progress to coronary artery disease definitely in next 3 to 5 years. So this 3 or 5 years is a window period of curability where you can counsel your patient, change his lifestyle, give him all the advices you want, and retard the onset of critical events like myocardial infarction and strokes in them. A beautiful study, female study. Look at the mnemonic, female experience of men's attitudes to life events. This is a survey done on women whose husbands had ED and they were questioned. Most of them felt that they can obtain sexual gratification even without erections. Some questioned that they were not attractive enough. Some felt their husbands have some lafras. And some felt it was not worth the relations to be kept, so they went in for divorces. But most of them agreed the quality of life was affected. There was frustration, sense of inadequacy, self-blame, and insecurity. Let me give you some scientific perspective. We know a normal endothelium will produce endothelial nitric oxide synthetase, which will potentiate the chemical currency of the cell, the nitric oxide, the main signaling molecule, which enters into the corpora cavernosa, smooth muscle cell of the penis, and converts GTP into cGMP, which relaxes the smooth muscles and allows the blood to flow in. But sadly, this cGMP hydrolyzes into 5-GMP with the help of an enzyme called phosphodiesterase 5. So if you look at the pathology or the physiology, all you need is adequate amount of endothelial nitric oxide synthetase and nitric oxide, or a normal endothelium. Today what we have is PD5 inhibitors, which are at the last stage, So what actually, if we want to have a therapeutic cure, you need to have good nitric oxide and endothelial nitrate. And in diabetics, because of increased advanced glycated end products, oxidative stress ultimately leads to functional endotheliitis and erectile dysfunction. So there is definitely a link in diabetes. But the risk factor of all risk factor is endothelial dysfunctions. My teacher, Dr. Paul, beautifully said it. You are only as old as your endothelium. Now in diabetes, what 3 things we need to know is that the mainstay treatment of ED is the therapy of PD5 inhibitors, and this is the first complication which occurs in diabetes. Hypogonadism is the second thing, and third thing, it's not just taking care of HbA1c, etc. You need to talk to your patients about these things and then counsel them very well. And besides this, testosterone also is important in diabetic because it maintains the integrity of the corpora cavernosa in every form. When there is glucose overload, there is increased advanced glycated end products, increased ROS, ultimately leading to decreased nitric oxide and apoptosis. Along with that, low testosterone will again result in corpora cavernosa smooth muscle cell dysfunction, leading to erectile failure. All diabetics are having hypogonadisms. There is functional and structural damage to it. There are a lot of causes of ED, but what basically we should know that in penis, if the nerves stimulate, vessels circulate, muscles facilitate, and hormones regulate, everything is fine. When we think of diabetes, is it due to aging? Yes, it can be due to aging, because if you age, that doesn't mean you have to be asexual or be only spiritual. It's all bullshit. When you age, what happens is, due to your bad lifestyle, there's increased ROS leading to endothelial dysfunction and vascular complications. So we are all going to age. So does age itself is a disease, or if life is a disease? No. At this stage of our life, we all are in a pro-inflammatory status. That we need to remember. And this status can be triggered into inflammatory states by our lifestyle. So, beautiful studies have shown that all stress, oxidative inflammation, cytokines through various pathways lead to inflammaging. And diabetes is an inflammaging disease. So, what do we do? There are lots of remedies for this. Now the buzzword is longevity. We all are thinking, why not to die? Why to die? Why not to age? This is what they're asking. So if you restrict calories, it will activate the mitochondria, produce increased AMP, and increase the production of sirtuins. Sirtuins are anti-aging proteins, amino acids. Sirtuin 6 is very good. It activates everything in the cell and increases the lifespan. Let me give you a deeper perspective. So you understood about the endothelium. Now what in diabetes is now understood that it also causes mitochondrial dysfunction. So the patients tell me, thak jata hu, I'm tired. They're not fooling. It's not just a sexual weakness or that giving them tiredness. It is definitely the loss of mitochondrial functions, because in persons with type 2 diabetes, high nutrient influx and consequent ROS productions leads to not only liver, muscle, heart, fatty acids and influx oxidative damage, but at the same time certain non-insulin sensitive tissues like eye, kidney, nervous tissue and penile vasculature are also affected. So due to various mechanisms, diabetes leads to mitochondrial dysfunctions, leads to erectile dysfunction, and of course contractile dysfunctions. So amongst the pathology, if you see it's hormonal changes, endothelial dysfunctions, neuropathy, cavernosal smooth muscle psychological effects, and of course mitochondrial dysfunction. So diabetes induced erectile dysfunction is both endothelium and mitochondrial dysfunction, and both lead to emotional dysfunction. So it affects the individual and the partner, and there is definitely a dent in the relationships. Now let me come to the second half of my talk. How do we manage ED? There are three modalities: oral drugs, injections of papaverine in the cavernous tissues, vacuum therapy, intraurethral prostaglandin. If all these fail, we send our patients to the surgeons to do implants or anastomotic surgery. But these will not work unless you counsel your patient and advise them strictly, continuously, permanently on lifestyle modifications. Lifestyle changes have been now the first line treatment. We have 4 PD5 inhibitors: sildenafil, vardenafil, tadalafil. You all have various onset of action and duration, but all have side effects like flushing, headache, nasal congestion, dyspepsia, etc. But only contraindication we all want you to remember is that nitrates. Anybody who's on nitrates, please do not give them PD5 inhibitors. But what is more alarming, 17 years of clinical experience we have with treating with PD5 inhibitors, but they are not the cutting edge pharmaceutical solutions. We are still not having a complete cure for ED in the form of medications. They say long-term use 12 weeks of tadalafil, irrespective of whatever be the HbA1c or hypertension or prostatic hypertrophy, dyslipidemia, they improve sexual dysfunctions. Yes, it does, but it's not a cure. You need to take it continuously. So oral testosterone has been tried. Of course, only sildenafil in diabetics don't work, so you need to supplement with testosterone. A lot of studies to prove that. Bariatric surgery improves the relationships, and also insulin pump. My friend Dr. Jyoti Dev has shown improvement in sexual function in patients who were on insulin pump. A lot of newer things are available: shockwave therapy, stem cell, platelet, gene therapy, but all lack robust evidence. So treating with ED till date, we have got no therapy which reverses the pathophysiology of erections. So they tried stem cells, it works. Herbal treatments with L-arginine and fenugreek have been shown fantastic results, because fenugreek saponized form has got structure similar to testosterone, and they replace the globulin bound and increase the free testosterone. Patients with Burritt syndrome are also improved today with metformin, sesame seed oil. What is new today? We have many new things which are coming and promising towards a cure. We have avanafil in the form of 100 mg and 200 mg. New PD5 inhibitor, onset of action is 15 minutes, half-life is 5 hours, and it's got the least side effect. And this is the only PD5 inhibitors you can give it to your patients who are on nitrates. Tell them to skip the nitrate on the day when they want to have sex and take avanafil. This will go away from their body in 5 hours, and next day again they can start with nitrates. We have films of sildenafil and tadalafil available with melatonin is to be deficient in patients with ED. So 3 milligram of melatonin also improves their functions. A new stim gel, oral just gel to be applied on the shaft of pelvis, Eroxon, 15 to 20 minutes patients get. We are doing a study with glyceryl trinitrate to be applied on the glans penis. In 20 to 25 minutes, we found patients getting good erections. So what is the ethical way to treat today? What is the ethical way? 40 to 50% patients don't respond to it. All diabetics should be put on SGLT2 inhibitors and metformin, because metformin also improves the endothelial dysfunctions. SGLT2 inhibitors, because of the class effect, reduce lots and lots of causes of vasculogenic erectile. We say diabetes is genetic. No, whatever happens to you is only 20% because of genes. 80% is because of your lifestyle. A lot of studies to prove that this can be solved. Now, a beautiful study showed that there are 4 polymorphisms of endothelial nitric oxide cells. There are a lot of diabetics with uncontrolled diabetes and high HbA1c, they still can have sex because of intron 4 gene in them, which is not giving them diabetes. So that's a new thing which has now come up. So please consider, you may be Hindu, Muslim, Sikh, whatever. Lifestyle should be your first religion. Because if you modify your lifestyle, you will improve your pro-inflammatory status, improve your insulin resistance, improve your oxidative stress and endothelial dysfunction, and improved well-being and improved sexual dysfunctions. Because most of the causes or risk factor are modifiable. It's diet, sedentary lifestyle, smoking, alcohol, etc. So what is the diet you can advise? All red colored fruits, vegetables, green beans, berries, avocado, seeds, flaxseed, chia seeds, pumpkin seeds, saffron, garlic, onion, ginger, almonds, walnuts, honey, dark chocolates, cow's ghee, milk, vanilla, white of the boiled egg and fish. But remember, don't give them any diet. 8 baje ye khao, 9 baje ye khao, 10 baje ye khao. No one can adhere to any diet for a long time. Give them a simple advice. Advise them to avoid SOS. The first S is salt. If you increase your salt, you will get hypertension, you will get sexual dysfunctions, medicines for lifetime, and it's a killer. O is oil, dyslipidemia, medicines for lifetime, sexual dysfunction, again a killer. Last S is sugar, diabetes, medicines for lifetime, sexual dysfunction, and it's a killer. Give them this blanket, put them in their head, poison their mind with this. Jada namak, tel aur ye mat khao. Ask them to fast for 12 to 16 hours a day, very important, and walk for 30 minutes and sleep for 6 to 8 hours a day. So today it's a word of artificial intelligence, but this will not create future, it is going to worsen the future. A lot of side effects of it. Nobel laureates from the scientific world with their extensive research are giving a better evidence, best evidence for longevity. How not to die, lifespan, why should we age and why we don't have to, why not to age. And they are all telling us to go back to basics. So what are basics? I said hormesis or sirtuins. We know sirtuins improve the cavernosal functions by caloric restrictions. Lots of studies, I will not go into, beautiful studies are there. Another factor is autophagy. We all have an inner capacity to wash ourselves, to clean ourselves with autophagy, and that can be initiated only with fasting, caloric restriction and fasting. Liraglutide ameliorates erectile dysfunction through autophagy. Another is hormesis. Stress your body to something more than what you are doing. This stress, continuous stress, little more stress, stimulate compensating, adaptive and reparative processes with key benefits. What doesn't kill you will also make you strong. Rapamycin also suppresses the penile NADPH and preserves erectile through hormesis and others. Erotism. See, sex is the same, pen is going into, but you need to initiate in a varied form because again, hormesis, a dose dependent novel sexual stimuli will increase your sexual health, brain health, biological amplitude. Studied, this is called erotism as hormetic stimulus. Then mTOR signaling, we know mTOR is very good for insulin sensitivity. Rapamycin improved the erectile dysfunctions in diabetic inducement. So these are the four mechanisms which can reverse your existing metabolic syndrome and increase longevity. 4, sirtuin, autophagy, hormesis and mTOR. Can we reverse the endothelium? Yes, my teacher Dr. R.D. Lele long time back showed several strategies to reverse the endothelium. So many drugs are available today. Testosterone has been tried and has shown good improvement in insulin sensitivity. Mitochondrial dysfunction can be improved with imiglamin, very good drug available today. OHA, beautiful, improves your coronary artery disease is reversible. Dean Ornish proved long time back. Cleveland Clinic clearly says that just with nutritional intervention, you can reverse the existing coronary artery disease and even halt it. So the onus of sexual health lies with you physicians. You need to take an onus. You need to break the silence. You don't have to wait for him to talk about it. So my take home message is, no one has today till date died of having sex. All people who had post-coital death were those people who took alcohol, smoking, and had sex with illegitimate partners. So medicine, friends, is not a health care. Food is health care. Medicine is sick care. It's time we realize today. It's not the medicines which they're going to, it's the food which will make you all right. 2 times Nobel Prize winner, Dr. Linus Pauling, clearly declared when he was receiving the second Nobel Prize, he announced to the world, who gets Nobel Prize? The 2 times Nobel Prize winner, when he's declaring to the world that nearly all disease can be traced to a nutritional deficiencies. What else you want? So the art and science of sexual fitness is based on what you put in your body and what you do with your body. And the secret of sexual fitness is love yourself. You're unique, you're different. Avoid salt, oil and sugars. Give a U-turn to your metabolic aim. Have a rhythm of sex life. Vitamin romance and touch is lacking today. There is no GST on romance and touch. Why you don't? So friends, remember, diabetes is an inflammatory disease. We all, as we age, are in a pro-inflammatory status. Hence, we need to avoid inflammatory processes in your body. So how can you do that? Muscle is anti-inflammatory and fat is inflammatory. So we all have logic, we all have wisdom. So we must, to rekindle the sparkle of your life, build muscle and burn fat. That's fair. So friends, unless we love and are loved, we all will remain lone and deeply lonely. The secret of sexual fitness is it's an evolving thing. It changes, but we need to fight with it. We must reclaim pleasure. Pleasure is all ours, our right. We must prioritize our pleasure. This is an attitude shift we must have, and that's a choice we have. Friends, sexual dysfunction in diabetes is not an option. We all going to get it, but we need to handle it properly. You know, we have all 4 PD5 inhibitors. They do not increase the desire. 40% patients don't respond to it. So we give them testosterone, but we need to give it with caution. We can't give it to younger people because of azoospermia, heart failure, and prostatic issues in elderly people. So who's the Raja of all? We have L-arginine, fenugreek, regenerative medicine, and lifestyle. Of course, activate sirtuin, autophagy, and hormesis. This is very important. So friends, today for ED, we have so many things in our armamentarium to give a cure to erectile dysfunction. Definitely we can, okay? So it's really a blessing to have ED and to reverse everything what we have. And so erectile dysfunction is a correctile dysfunction. Friends, this tragedy in the bedroom can be turned into bliss. So if you have patients for ED, don't send them to quacks. Treat them yourself. You know it now. What else you need? Just take a detailed history and reverse his lifestyle, what he's doing. If you can't, send him to a good sexologist, he will see that he gets a good erections. Friends, there is no law which says you must age. Build muscle, burn fat. Your body has a capacity to stop senescence. Monogamous relationship is like a garden and polygamous relationship is like a jungle. You have to decide whether you want to be a gardener or a jungly. Choice is yours. And cultivate your own garden. Be monogamous. Voltaire so beautifully said, try and cultivate your garden. This is my book, Sex Has No Expiry Date. Friends, this is Banaras. My favorite leader is from this state. So he said, be passionate, fearless, and focused even in the bedroom. That's important. So my last slide, friends, diabetes is the sexual health tsunami of our century. Erectile dysfunction is prevalent and the earliest marker of coronary artery disease. 4 PD5 inhibitors are effective. Low dose PD5 inhibitors, statins can be the ideal choice. Testosterone short course can be given with caution. L-arginine supplement with fenugreek is a boon. Activate serotonin, autophagy, mTOR, and hormesis. Diabetes remission is a fact and not a myth anymore. Hence, erectile dysfunction is a correctile dysfunction. Take a detailed history, counsel your patients, be emphatic and educate them. Give them realistic expectations. Don't let your diabetics die in bits, friends. If you do so, sex has no expiry date. Thank you all for your love. I'll be happy to answer any questions you all have.
Thank you, sir. So next speaker is Dr. Supriyo Mukherjee.
Thank you, Dr. Jumani. Thank you so much for your all talk. And sir,